Hello gentlemen, I'm Dr. Emily Carter. Every single week I sit down with men, some in their 50s, others well into their 70s, who lean in and ask me quietly, "Doctor, is it possible to increase penile length, or am I just stuck with what I have now?" And I see it, that mix of curiosity, frustration, and a bit of shame. So let me start by saying this clearly. You are not alone and you are not broken. This is one of the most common questions men ask as they age, and there's a very good reason for it, because over time, many men notice changes. Things look smaller, feel different, and that can affect confidence in ways most people never talk about. But here's the truth. It's not your imagination. It's not hopeless. And most importantly, it's not permanent. In today's video, we're going to break through the myths, the false promises, and the expensive gimmicks. And I'm going to show you step by step how real urologists actually help men restore and even increase penile length, naturally, safely, and scientifically. So if you've ever wondered whether there's anything you can do, stay with me. Because by the end of this video, you'll understand exactly what's happening inside your body and what you can do to take back control. Before we talk about what works, we have to understand what's actually happening, because most men who come to me say, "Doctor, I swear it's getting smaller." But in most cases, it's not truly shrinking, it's simply becoming less available. The structure, the tissue, is still there. What's changed is the environment around it, and there are three main reasons why that happens. As we age, weight tends to settle in the lower abdomen, that small pad of fat right above the pubic bone. Now this might sound harmless, but anatomically it makes a big difference. That pad can bury the base of the penis, almost like a hot dog sinking into an oversized bun. The result? The visible part looks shorter, even though nothing has actually changed in structure. In fact, studies show that for every 30 to 50 pounds of weight gain, you can lose roughly 1 inch of visible length. It's not because your body took something away, it's because you've covered it up. The good news, when you lose the fat, you gain that visibility back. That's one of the most empowering truths I tell my patients. It's not gone, it's just hidden, and you can uncover it. Now let's talk about the second reason, circulation. Blood flow is life. It keeps the heart beating, the brain sharp, and yes, the penis healthy and functional. Penile tissue, like any muscle, depends on a steady supply of oxygenated blood. When you stop using it regularly, or when you live a sedentary lifestyle, blood flow slows down, and over time, those tissues start to lose their elasticity. They hold less oxygen, less flexibility, and what was once a soft, supple structure becomes tighter and less pliable. Now, not every case is about fat or blood flow. Some men have a real structural condition called Peyronie's disease. This is when fibrous scar tissue, a plaque, forms inside the penis. It's firm to the touch, and it can cause a bend or curvature during erection. For many men, it's not just uncomfortable, it's distressing, because it can shorten the shaft, pull the tissue unevenly, and even make intimacy painful. Now that we understand why it happens, let's talk about how to reverse it, because here's the part that most men never hear from their doctor. You can do something about it. That fat pad we talked about earlier, every pound you lose helps shrink it, and that means more of your natural length becomes visible again. Research shows that for every 30 to 50 pounds lost, you can regain up to 1 inch of visible length. That's not wishful thinking, that's anatomy. But here's the part most men don't realize. Weight loss doesn't just reveal what's hidden, it actually restores function. Because as you lose fat, you improve circulation and hormone balance at the same time. Less fat equals less aromatase, the enzyme that converts testosterone into estrogen. Less inflammation equals better blood flow to every vessel, including those in the penis. Better insulin control equals more nitric oxide production, the molecule responsible for erections. So this single change doesn't just make you look better, it brings your body back into balance, hormonally, physically, and emotionally. Once the foundation is set, your weight's coming down, your blood flow's improving, it's time to work directly on the tissue itself. Now, I know the idea of traction devices can make some men nervous. It sounds uncomfortable, even a bit strange, but let me assure you, this is a legitimate medical therapy, not a gimmick. Penile traction devices, sometimes called extenders, apply gentle, consistent tension along the shaft. It's not about pulling hard or forcing results. It's about consistency. Here's the science behind it. When you apply a light, steady stretch to living tissue, the cells inside sense mechanical pressure. In response, they start a process called mechanotransduction. That simply means cells adapt to tension by creating new tissue, new collagen, new elastin. Just like muscles grow when you train them, over time, that process gradually expands and lengthens the tissue. It's slow, yes, but it's real. Most medical studies report an average increase of 1-2 centimeters in flaccid length after several months of consistent use, sometimes more, and the benefits don't stop at length. Improved elasticity also enhances comfort, circulation, and even self-confidence. But there are 2 golden rules every man must follow. Use only medical-grade, clinically tested devices. Cheap products online can cause uneven tension, pain, and even nerve injury. Be patient. This isn't a weekend project. You're encouraging your body to rebuild tissue. And that takes time. Think of it like physical therapy for one of your most important muscles. Now, if you're dealing with Peyronie's disease, that scar tissue or curvature we discussed earlier, there's an FDA-approved non-surgical option called collagenase Clostridium histolyticum, known by its brand name Cyaflex. This treatment involves a series of small injections directly into the scar tissue. What the enzyme does is break down the tough collagen fibers that are pulling the penis to one side. Over time, this helps straighten the curvature and, in some cases, regain some of the lost length. It's not something you can do on your own, and it must be performed by a trained urologist. But it's effective, safe, and often life-changing for men who've struggled silently for years. Finally, for men who have tried all other methods and still seek improvement, surgery can be an option. But I want to emphasize, it's not for everyone, and it's not a quick fix. The most common surgical procedure is called a suspensory ligament release. Here's what that means. The penis is anchored inside the body by a ligament attached to the pubic bone. When that ligament is cut and released, the internal portion of the penis drops slightly outward, revealing some of the hidden length. The result is an increase of about 1 to 2 inches in visible flaccid length. But here's the important part. Surgery requires patience and aftercare. You'll need to use a traction device post-operation to prevent the ligament from reattaching and to maintain the gains. And like all surgeries, there are risks: infection, nerve injury, altered erection angle, or changes in rigidity. So gentlemen, after everything we've discussed today, here's what I want you to remember. You are not at the mercy of your age. You are not broken, and you are not stuck with what you have now. The changes you've noticed aren't a punishment. They're a reflection of how your body evolves. And just like any other part of your health, what's lost can be restored when you give it attention, time, and care. When you take steps to lose weight, to move more, to improve your blood flow, you're not just improving your length, you're improving your heart, your hormones, your energy, your confidence. This isn't vanity, this is vitality. It's about feeling strong in your own skin again, so don't waste another dollar on false promises or magic pills. The most powerful change starts with you, with a walk, a better meal, a little patience, and the courage to take back control of your body.